عليكم أعزائي الطلبة. أتمنى أنه تكونون إن شاء الله في أتم العافية. محاضرتنا اليوم راح تكون about antituberculosis drugs, medications that are used for the treatment of tuberculosis. Unfortunately, TB is still common in Iraq, and the problem with tuberculosis is sometimes it's just dormant, so you might have it for a long period of time before presentation. ليش important إنه احنا نرسل البيشنت عنده TB أو لا؟ طبعا to treat because first of all to treat لأنه it can be disastrous if untreated، وأكيد انتوا تعرفون عندنا pulmonary و extra pulmonary TB، أو at the same time for tuberculosis, if it's dormant and the patient doesn't know that he has tuberculosis, and then you put him on immunosuppressant drugs for treating other diseases that might he suffer from, this can result in reactivation of his dormant tuberculosis and can be disastrous. لذلك because we are endemic actually in Iraq, قبل ما نبدي البيشنت على any immunosuppressant drug نسوي له investigation نتأكد إنه هو عنده TB أو ما عنده TB. Okay, to put him on anti-TB medications to treat his illness. So why tuberculosis or Mycobacterium tuberculosis is basically nasty type of bacteria. What I mean by nasty, يعني it's very bad. It's different from ordinary bacteria, and it's bacteria. Okay, so we expect that it should respond to the available antibiotics that we have, but unfortunately this is not the case. يعني انتوا احنا مثل ما تعرفون انه من نقول بكتيريا نقول نفكر بالانتيبيوتكس. Okay, whatever any kind of bacteria عندنا different antibiotics and we treat accordingly حسب sensitivity and the activity of the antibiotic. When it comes to tuberculosis, it's not. So they're not responding to the actual antibiotics. Why? Because of few reasons or causes. First of all, they grow slowly than other bacteria, and we know that most of the antibiotics that we have, they are effective against rapidly growing bacteria. Okay, so they're not effective against the slowly growing ones. This is one thing. The second thing, mycobacterial cells can be dormant. يعني شنو؟ شوفوا لما تكون dormant يعني it's not active، يعني بس مجرد dormant مثل ما قلت. It's not replicating. It's not doing anything. فبالتالي احنا مثل ما تعرفون الانتيبيوتكس they affect certain steps بالبكتيريال growth. يعني أما affect the protein synthesis مثلا أو affect the cell wall synthesis. من تكون السيل is not replicating، البكتيريا من تكون is not replicating، ما عندك فد هدف الانتيبيوتيك كان attack أو كان work on. Okay, so that means they are completely resistant للantibiotics, ordinary antibiotics. بعد they have thick، خلينا نقول الميكوبacterial wall, cell wall is very lipid rich, which is impermeable to many drugs. So drugs cannot cross, ordinary drugs cannot cross the cell wall. Another reason for the fact that most antibiotics doesn't work on mycobacteria is that these cells, these bacteria are intracellular. So they reside inside the macrophages, inside the cells. وبالتالي again, the available antibiotics cannot penetrate these cells to attack these bacteria. Plus mycobacteria by itself, they can develop resistance. يعني you treat them with this antibiotic, and after a while they have their own mechanism. They have their own mechanism of developing resistance against the available antibiotics. That's why never ever think of treating tuberculosis with single agent. So whenever we talk about TB, you have to know that multiple agents are needed to treat tuberculosis, as if you are treating cancer actually. Most of the time we need combination of chemotherapeutics, and we have certain regimen to treat cancer. This is almost the same. Okay, so as you see from this diagram, we have different regimens to treat mycobacterial tuberculosis. And as you can see, sometimes we have 3 agents like isoniazide, rifampicin, pyrazinamide. Sometimes isoniazide with rifampicin, rifampicin with ethambutol, and 2 different combinations. But I need you to pay attention to the duration of treatment. So it's 6 months, 9 months, 12 months, and sometimes more than 24 months. For more than 2 years, you are treating tuberculosis. So it's not a 1-week course of antibiotics or 2-week course. We are talking here about months. So 1 month, 2 months are not enough. You have to know that you need to use combinations plus to treat for a long period of time. Okay. So the first agent in this group, anti-tuberculosis drugs, is isoniazide. This is the most active, the most common, the widely used one, and the most effective actually. So what it does basically to kill the mycobacteria is through the inhibition of the synthesis of mycolic acids, which is important for mycobacterial cell wall. So if there is no cell wall, the bacteria can't make the cell wall. That's it. It's dead. The good thing about isoniazide, it diffuses into all body fluids and also in the caseous material as well. So like when you have TB lesion in the skin, for example, or anywhere else in the body, if you open it, you will see that there is necrotic tissues resembling cheese. The good thing about isoniazide, it can access and can diffuse into this caseous material. It can also cross the meninges, and the concentrations of isoniazides in the CSF are similar to that of the serum. So if you have TB meningitis, then isoniazide is a good drug of choice for treatment of TB meningitis. Okay. The most important side effect of isoniazide is hepatitis. Unfortunately, can cause hepatitis if it's used for a long period of time, and it can also cause peripheral neuropathy. But they found that the peripheral neuropathy that is caused by isoniazide as a side effect is due to the deficiency of pyridoxine. So if you provide the patient with pyridoxine, which is vitamin B6 supplement daily, then you can avoid the development of this side effect, the peripheral neuropathy. Okay, Another important antibiotic that is used in the treatment of tuberculosis and effective against many other types of bacteria is rifampicin. And rifampicin basically inhibits RNA synthesis. So there is no RNA, no cells growing, cell death. That's it. Again, the good thing about rifampicin is that it's distributed widely in body fluids and tissues, so we can access any type of tissue and any organ. So whether you have TB of the bladder, TB of the lungs, TB of the meninges, TB of the bone, you can use rifampicin. Another good thing about rifampicin is that it is effective against both intracellular and extracellular mycobacteria. So it is effective against the mycobacteria that resides inside the cells and the ones that are found outside the cells as well. Also, it's effective against many gram-positive, negative, and negative organisms. It can be used prophylactically for patients exposed to meningococci or Haemophilus influenzae, and it's also effective against Mycobacterium leprosy or leprae. So it's a good antibiotic. It's effective against tuberculosis and against other gram-positive and negative organisms. The most common adverse side effect of rifampicin is nausea, vomiting, and rash. Also, another thing that I need you to remember about rifampicin is that it causes orange color. It gives orange color to urine, sweat, and tears. يعني تقول للمريض when you put him on rifampicin that you might have discoloration of your teeth. عيونك الدموع مالتك هتكون برتقالية interesting. والسويتنج أيضا ممكن تلاحظ أكو change بالcolor and also change بالurine. وإذا البيشنت تجيك patient حاطة lenses تستخدم lenses وأنت you put her on rifampicin, the lenses can be stained permanently because of the tears, because of the stained tears. Okay, so this is one interesting fact about rifampicin. The other thing that I want you to always remember about rifampicin is that it is a hepatic enzyme inducer, a cytochrome P450 inducer. زين شنو المشكلة وإذا هو hepatic enzyme inducer؟ مثل ما تعرفون most of the drugs that we give to the patients are metabolized by cytochrome P450. So if the patient is taking rifampicin and at the same time he is receiving another type of medication, then rifampicin might increase the metabolism of the other medication, which means it might decrease the effectiveness of that medication. يعني تجيك وحدة مثلا example of this، وحدة تاخذ pills contraceptive pills وأنت تعطيها ريفامبيسين، ترجع لك ورا فترة شو تقول لك؟ دكتور أنا صرت حامل، مع العلم إنه أنا دا أخذ البيلز and I've never missed a pill. So why؟ ليش؟ لأنه أنت عطيتها ريفامبيسين وريفامبيسين increase the metabolism of her contraceptive pills, so they are not effective anymore, and she ended up being pregnant. So it's very important to always remember and to put in your mind that rifampicin is an enzyme inducer. Okay, so it increases the elimination of many other drugs. A third interesting agent and widely used this group is the ethambutol. Ethambutol is bacteriostatic. Okay, so it's just it doesn't kill. It's not cidal. It's static. What it does basically, it inhibits one of the enzymes that is important for the synthesis of mycobacterial cell wall. Ethambutol, if you have a patient who has meningitis, you need to know that ethambutol crosses the blood-brain barrier only when the meninges are inflamed. يعني إذا ما عند البيشنت meningitis هو ما يروح للبلد brain، ما يروح للCSF، can't cross the blood-brain barrier. فقط إذا المننج is inflamed, then this medication can cross and go to the CSF. Important side effect of ethambutol is optic neuritis, so inflammation of the optic nerve, which might affect the visual acuity and might affect the patient's ability to differentiate between red and green colors. Okay. شوفوا يعني هي هاي الميديكيشنز البيشنت ياخذها for long period of time، فلذلك تشوفون وهي يعني أقوى من الأنتيبيوتكس العادية، فتشوفون شوية عندها serious side effects, and you need to know each one which kind of side effects might result in. Okay. Pyrazinamide. Again, it's what it does. It disrupts the mycobacterial cell membrane metabolism and transport function. So it affects the cell membrane activity. It's one of the important drugs that are used as a first-line medication for the treatment of tuberculosis. Usually is given in combination with isoniazide and rifampicin. Actually, this is the most common combination that is used for the treatment of tuberculosis, which is the three of them: isoniazide, rifampicin, and pyrazinamide, used for 6 months. And pyrazinamide is acting as a sterilizing agent. يعني شنو sterilizing? It's effective against the residual intracellular organisms that might cause relapse. يعني organisms that are have not been killed by or eliminated by rifampicin and isoniazide, pyrazinamide actually can get rid of them. Again, it is hepatotoxic in some patients and may cause nausea and vomiting as a side effect. حقيقة أنا ما حبيت أثقل عليكم كلش وأدخل بالديتيلز of these antibiotics لأنه هي صراحة they are not widely used. So I tried to mention just the important points about each medication. Another agent that we have is streptomycin. Streptomycin it's effective mainly against the extracellular tuberculosis. So it does not penetrate the cell membrane. Again, it does not cross the blood-brain barrier under normal circumstances unless the meninges are inflamed. Streptomycin, if used for a long period of time, then it's ototoxic and nephrotoxic. So you need to follow up the patient and assess him for the development of these side effects. Okay. So the drugs that we mentioned, isoniazide, rifampicin, pyrazinamide, ethambutol, streptomycin, these all are called first-line drugs for tuberculosis. Then we have second line. So why are we having second line? Basically, if the first line is not working, yeah, as simple as this. So if you have resistance, when you're gonna use the second line drugs, if in case that you have resistance to the first line, so you put the patient on the first line, combination and the patient is not responding, or it's already the bacteria is resistant, or in case of you having treatment limiting adverse drug reactions. As you remember, probably I mentioned for each of the previous medications we have kind of serious side effects such as hepatitis, optic neuritis, so ototoxicity, nephrotoxicity. So if the patient is already on one of the first line medications and developed one of these serious adverse effects, or if he is not responding to the first line medication, then you put him on the second line drugs for the treatment of tuberculosis. Okay, so for the second line, we have three medications: ethionamide, capreomycin, and cycloserine. Ethionamide is chemically related to isonazide, and it also blocks the synthesis of mycolic acid. It's only available orally. It can cause gastric irritation and neurological symptoms as a side effect. While capreomycin given parenterally, and ethionamide only available in the oral form, capreomycin is administered parenterally, and what it does basically, it inhibits protein synthesis, وبالتالي interferes with cell growth. So, capreomycin is primarily reserved for the treatment of MDR-TB, which means multiple drug-resistant tuberculosis. So it's not a first line. It's only used when you have the patient when you put the patient on more than one medication for the treatment of tuberculosis and the patient is still not responding, then you can think of capreomycin as a treatment for such patients. Again, capreomycin, because it's similar to aminoglycosides, so it's all the aminoglycosides, most of them, as we know, they can cause nephrotoxicity and ototoxicity. So you need to monitor the patient, monitor the renal function and hearing of the patient to avoid the development of these side effects. The third agent is the cycloserine. Cycloserine is an orally effective agent, so it's given orally. It interferes with the synthesis of bacterial cell wall. يعني هسه صار عندنا الإثيوناميد and cycloserine, both of them interferes with the synthesis of bacterial cell wall. In terms of the distribution, it's distributed widely throughout the body fluid, including the CSF. فما عندنا مشكلة. Again, the most important side effect that might happen with cycloserine is CNS disturbances and seizure, which might happen actually as a adverse effect of such medication. So as you know, as I said, this is a very nasty type of bacteria, unfortunately. You need to have the patient on combination of antibiotics, and you need to treat for a long period of time, and you need to monitor for the development of resistance. You need to monitor the response of the patient, and you need to monitor for the development of side effects. So you need to be really aware about side effects of these medications. فلذلك تشوفون التوبركلوسيس actually مرات يعني مو مرات أغلب الأحيان عندكم أكو يونت خاصة بالمستشفى where they treat tuberculosis and they know all about it. So they are like better than others, or in a better position than others for the treatment of tuberculosis. Thank you for your listening, and all the best for your final exams.